Hello and welcome to Life is Movement for another exercise demonstration. I make these videos for my patients here at my clinic. However, if you're not a patient and you find any of these exercises valuable, you are of course welcome to use them for your own benefit. Just make sure you do so safely. So this is an exercise I give often in the early stages of a shoulder injury, particularly if there's anything going on with the rotator cuff, which are those four little muscles that stabilize and support the shoulder, particularly in dynamic movement. And what I find with rotator cuff injuries of any kind is that often a funny movement we call abduction, abduction, which is basically this, raising your arm out to the side, often becomes quite compromised. Either the whole range of motion is quite painful, or in particularly bad cases, sometimes it just becomes completely limited and people get to about here and they just say, look, I can't go any further, it's way too painful. And another common thing is we can often see something which is sometimes referred to as a painful arc, where it sort of feels okay till about here, and then sort of from about here to here is painful, and then past there it feels okay again. That's also something we see quite commonly. In the early stages of this type of injury, particularly if you're someone who gets a little stuck or you're pain limited, which basically means you can't go past here because it's too painful, it can really help to do what we call isometric exercises, which is basically holding against some sort of resistance. So in the very, very early stages, I'm going to move all the way back here, particularly in cases where the pain starts quite low, it can really help to do what we call a wall isometric. So I'm just going to use my squat rack here. And what you're going to do, you're going to stand some distance from the wall. I'm about sort of 15, 20 centimeters away here. And I'm just going to hold the first part of that abduction motion against the resistance of the squat rack. Now, I'm not pushing into too much pain. I'm probably going to use about 50% of my total strength. So here we go. So I'm just going to push against that. As you can see, there's no movement, but I am using resistance here. So it's an isometric resistance. There's no movement going on. I'm going to hold that for 5, 4, 3, 2, 1, and relax. And then the protocol I normally use is 5 repetitions of 5 seconds with a couple of seconds of rest in between. So you hold 5, 4, 3, 2, 1, and relax. Wait a couple of seconds. And again, set 2, 5, 4, 3, 2, 1. Relax a few seconds. And then let's say set 3, 4 as such. And then set 5, 5, 4, 3, 2, 1, and relax. A really simple protocol, but what the research shows is that those isometric type holds can not only build up the musculature again, but they also can be quite pain relieving. So if you're at the early stage of an injury where pain is quite high, pain is quite acute, this can be an excellent exercise. Really important for this exercise. You're not trying to put your hand through the wall or the squat rack or whatever object you're using for resistance. Only utilize those principles of tolerable discomfort. So the amount of power you can put in will be dictated by the feel. 2, 3, maybe 4 out of 10 discomfort, what most people describe as tolerable discomfort. We're not pushing into pain here. Over time, the amount of force, the amount of strength you're able to use will increase within that same pain threshold. Try that exercise for issues with your shoulder.